Hello everyone. Good morning. A very good morning to all of you. I welcome you all for today's session. So today we are going to cover a ultra important topic, that is thrombosis and embolism. We will cover it today. And whatever exam you are targeting, if you're a second prof student and going to write your university exam this year, this topic will be very important and it will be coming in long question, or maybe one of the part may be coming in the short or very short. And if you are targeting for any of the competitive exam, NEET, PG, FMG, INICT, USMLE, PLAB, so you get many MCQs based on this, clinical MCQs as well as image based MCQs based on this topic. So without wasting any further time, let's start it. Can I start? Yes, I shall. Give me a minute to share my screen. I guess you can see my screen also. So let's start thrombosis and embolism. Let's start it. Okay, so first I will teach you thrombosis and then I will move on embolism. But before understanding thrombosis, you must understand one more thing, that is hemostasis. If you don't understand hemostasis, you cannot understand thrombosis. If you can't understand thrombosis, you can't understand embolism. So all the things are related to each other. So let me start from the beginning, from the basic. I'm assuming you know nothing, you know anything. Okay, so let's start with hemostasis. Let's start with hemostasis. So what is hemostasis? For example, I got a cut over here or injury on any part of the body. If anyone have injury on any part of the body, what happens? Of course, the person will bleed. So there will be bleeding from that point, the area where we have the injury. Okay, because the blood vessel in that area is disrupted. So there is a defect in the blood vessel. You can see there is a defect in the blood vessel from which the bleeding takes place. Now, all the humans have 5 liters of the blood. Okay, the adult humans have 5 liters of the fluid, the blood. So that will leak out. But thankfully, for how long I will bleed? I will bleed for the next few seconds or minutes. What happens after that? The bleeding will stop automatically. The bleeding will stop automatically because thankfully God has given a physiological phenomenon which is known as hemostasis. So first you have to understand hemostasis. What is hemo? What is hemo? Hemo means bleeding. Stasis means stoppage. So the words itself depict its meaning. So it is stoppage of the bleeding after injury automatically. That is a physiological phenomenon. So you tell me, thankfully God has given this mechanism inside us. Otherwise, even a small trivial injury can lead to lots of bleeding. All the 5 liters of the blood can leak out from a small defect and the person can go in shock and die. But thankfully, it doesn't happen because we all have hemostasis, inbuilt hemostasis in us. So whenever we have injury, this system gets activated and it seals the defect. The defect in the blood vessel is sealed by the formation of a clot. The clot is formed. In hemostasis, clot is formed. You can see this is the clot. It is sealing the area of the defect in the blood vessel. So this is hemostasis. It's not a disease. It's a good phenomenon. It's a physiological phenomenon in which the bleeding is stopped after injury. It is not harmful for us. It is useful for us. So you got it? I hope you got it. Can we go ahead? So this is hemostasis. Now, for understanding thrombosis, you have to first understand hemostasis completely. So first you have to understand how does hemostasis occur. How does hemostasis occur? So tell me, how does this clot is formed? So there are 4 steps. As soon as I have an injury on anywhere on the body, 4 things will happen one by one. The first thing happen is arteriolar vasoconstriction. The second is primary clot, then secondary clot, and finally there is resorption of the clot. So one by one we will see the 4 steps. You can see this is a blood vessel. Let me show you. This is a blood vessel. You all can see. In this blood vessel, I want you to see the lining. I mean endothelial lining of the blood vessel. This is the endothelial lining, continuous. Here it is disrupted. Here it is disrupted. So this is the area of the defect where the endothelial lining is disrupted. So this is the site of injury. So you can see this is the site of injury. So to locate the site of injury, you have to trace the endothelium. So please trace the endothelium and see where the exactly injuries. So you can see this is the area, the site where the injuries. So just suppose I got a cut over here. So everywhere we have blood vessel. So there may be a blood vessel just within this, just below this area. So that area got disrupted. You can see this is the disruption. This is the site of injury. Now the bleeding will occur. So from this point, the bleeding will occur because there is a defect. There is a defect. Okay, so the first thing happen is vasoconstriction. This area undergo vasoconstriction. There is focal vasoconstriction in the blood vessel. Why God has given this vasoconstriction wala step? Because if there is a vasoconstriction, less blood will come in this area. If less blood will come, less bleeding. So meanwhile, the time taken to form the clot, this focal arterial section undergo vasoconstriction. So less blood is coming in this area. So less chances of bleeding. So but it is very transient. It is immediate and very transient. If the clot is not formed immediately, now the bleeding will resume. So it is transient only for the next few seconds or minutes. It is transient, vasoconstriction. The second step is primary clot. So the first step is vasoconstriction, which is transient. It is the first step. Now after that the primary clot is formed, then secondary clot is formed. Let me tell you what is primary clot. No, rather I will draw it for you. What is primary clot? I will show you the primary clot here. Just a second. Okay, so you can see here I am drawing a blood vessel for you. Okay, this is the blood vessel, and let me draw the endothelial lining. So this is the endothelial lining. You can see this is continuous everywhere. So here also it's continuous, here it's continuous, but in the center you can see there is endothelial lining disruption. So this is the site of injury from which the bleeding is taking place. I want to seal it. I want to make a primary clot. I want to seal it. So we have three type of blood cells: RBC, WBC, platelet. So I am interested in platelet now. Platelet. So let me draw the platelet, because platelet are the main cell that will form the primary clot here. So these are the platelets. Can you see I'm drawing the platelets? Whatever platelets are passing from here in the blood vessel, they will come and they will seal this area like this. So let me show you how the platelets are sealing. Have a look. So these are the platelets I'm drawing here. The platelet will form the first row. This is the first row. Okay, they are sealing. Okay, and after that, what they will do? The first row. So they will form a bond. There are receptors on the platelet. These are the receptors on the platelet. They will form a bond with the subendothelial tissue. You are getting my point? So this is the subendothelial tissue. This is the subendothelial tissue. They will form the bond, but they cannot directly form the bond with the subendothelial tissue. They require a bridge. The name of the bridge is von Willebrand factor. So you can see I'm drawing the triangles. These triangles are acting as the bridge. And this is von Willebrand factor. And this step is known as platelet adhesion. What is this step known as? Let me write. So this step, the first step is known as platelet got adhered. Adhesion. In adhesion, the platelet form bond with the subendothelial tissue with the help of a bridge. With the help of a bridge. The name of that bridge is von Willebrand factor. Name the receptors. You must ask, ma'am, what is the name of these receptors you are drawing here? What is the name of these receptors which are forming the bond with the subendothelial tissue via with the subendothelial tissue via von Willebrand factor? So the name of these receptor is glycoprotein 1A2A. 1A2A or glycoprotein 1B9. These are the two type of receptors. One of them is present and they are forming the bond with the subendothelial tissue. So the first step is over. Okay, now inside these platelets we have granules. We are having the granules. So the platelets will release the granules outside. They will secrete the granules outside. So that to call the other platelets for help, that please come here, everyone, all the platelets come here, we have to make a clot. So they are calling other platelets for help. So whenever they are secreting the granules outside, this step, the second step, it is known as platelet activation. Platelet activation, they are activating other platelets. So first there is platelet adhesion, then platelet activation. Now other platelets will also get stimulated. They will also get stimulated, activated, and they will come here and they will form a bond like this. So they will make the subsequent rows. So first row is there, now second row, now third row, now fourth row, likewise. So subsequent rows are there. So all these platelets, except the first row. See, I have drawn the first row with blue color and rest all the rows with you can see I have drawn with black color. So these rest all the rows. It is known as platelet aggregation because they are forming the bond with platelet and platelet. The bond is between two platelet and platelet. The first row was forming bond with the subendothelial tissue. That is platelet adhesion. But whenever there is a bond between platelet and platelet, it is platelet aggregation. So the third step is platelet aggregation, the last step. And finally, the clot is formed. So you must ask, ma'am, what is the name of these receptors? The bond between platelet and platelet. There is no bridge required here. There we require a bridge, but here no bridge is required. So what is the name of these receptors which are forming the bond between platelet and platelet? So again, it's a glycoprotein. It is known as glycoprotein GP2B3A. 2B3A. So you have to learn the name of these glycoprotein, the receptors, so that you can understand the diseases of the platelet functional diseases. Currently, my topic is not that, but you have to understand it if you want to understand the mechanism of thrombosis. Okay, so there are 3 steps. What are the 3 steps I taught you? Can you tell me? So say, ma'am, there are 3 steps: platelet adhesion, platelet activation, and platelet aggregation. These are the 3 steps. What do you mean by that? In platelet adhesion, the platelet is forming the bond with subendothelial tissue via von Willebrand factor. In platelet activation, they secrete the granules outside. And finally, in platelet aggregation, platelet is forming bond with platelet. Give me a thumbs up if you all got it. Say yes if you all got it. So this clot which is formed is primary clot. This is primary clot. The primary clot formation is over and it is sealing this area, the area of the defect. So I mean to say the primary clot is made up of only one thing, platelet. That's it. First platelet are coming and they are showing adhesion. Then they are doing activation. And finally, they are doing aggregation. So three things happen one by one. Platelet adhesion, activation and aggregation. In addition, platelet is forming bond with the subendothelial tissue. In activation, they secrete the granule. And in aggregation, platelet form bond with the platelet. And you know the name of the receptors also. Give me a thumbs up. Come on, you got it. This is primary clot. You see, ma'am, now it's over. I mean, what was the problem? There was a defect. The defect is sealed. The thing should be over. Now, why you are continuing the third step and fourth step? First, there was a vasoconstriction and now the clot is formed. The primary clot. The primary clot is already there. Now, you should think, ma'am, why it is necessary to convert the primary clot into secondary clot? Now, the next step is secondary clot. The primary clot ko kyun convert karna hai? Why I want to convert primary clot into secondary clot? Primary clot is good enough. It is maintaining the integrity. The defect is sealed and the problem of the bleeding, it stopped. Now, why I should convert? Because the answer is primary clot is very fragile. It's very fragile. You know, it will disrupt again. So it is only for momentarily. You have to stabilize it. It's very fragile. So basically, I want to convert the primary clot, which is made up of platelet, into secondary clot. Because primary clot is very fragile. It's very delicate. It will disrupt. So you have to stabilize it. Hana? So once you stabilize it, it will convert into secondary clot. So you may be thinking, ma'am, how to stabilize it now? So this is same. Over it, I will put one thing additional. What is that thing? You know, there are 12 coagulation factors, factor number 1 to factor number 12 in our blood. They all are inactive and there is a cascade, intrinsic pathway, extrinsic pathway, common pathway, and finally there is factor number 1. I want to activate one, but I cannot directly activate one. So there is a cascade, either this way or this way. Finally, one is activated. One is fibrin. So I want fibrin. Fibrin is thread. Hindi mein kaho to dhage ke jaisa hai. The fibrin is like a thread. So I want to tie this primary clot with a thread, with a rope, with a thread. This is the rope or the thread I'm drawing. With a rope or thread, I want to tie it so that it got stabilized now. You got my point? So I am tying, I am tying the primary clot with a rope or a thread. The rope or thread is fibrin. So I need fibrin so that I can stabilize it. So basically, secondary clot is equal to primary clot plus fibrin. Only one thing is additional, fibrin. What is fibrin? It is coagulation factor number 1. For that, one cannot come directly. If you want to activate one, all 12 have to come in the role. So basically, primary clot is made up of platelet. Only platelet. But secondary clot is made up of platelet. Platelet to hai. Platelet is already there. Plus coagulation factor. So if there is any defect in the platelet, there is defect in the primary clot. If there is any defect in the coagulation factor, any of the 12, it will lead to defect in the secondary clot. So this is secondary clot. How many of you got it? So primary and secondary clot is over. So same thing is shown to you. You can see this is the primary clot is formed. You can see this is the platelet adhesion. You can see the first row is coming. You can see this is activation. The granules are secreted. And the subsequent platelet aggregation. You can see the primary clot is made up of platelet. And finally, the secondary clot. You can see the yellow color thread over the primary clot. This yellow color thread over the primary clot is fibrin. And fibrin, if you want to activate the fibrin, all the 12 have to come in the role. So that is the secondary clot is formed. And finally, when the healing is over, I cannot keep the clot forever. This is my blood vessel. So this is the endothelial lining. Here I was having the defect. This is my defect. So here first primary clot is formed, then secondary clot is formed. This is primary clot, for example. Okay, this is primary clot, and over which I have stabilized it with the secondary clot. So for example, this is secondary clot. But now the healing is over. Now here endothelial lining is again formed. It is over. So I cannot keep this clot forever for here because it is obstructing the flow of the blood to some organ. It is obstructing. It is an obstruction. So in the next few days, I want this to be resolved. I want it to be resolved so that it is not obstructing the flow of the blood. Temporarily it was okay, but I cannot keep it permanent. So for resolution, we need plasminogen. Plasminogen will convert into plasma and resolve it. So these are the 4 steps. How many of you got it? Let's come on our topic today. If you got this overview, now you can understand what is thrombosis. Can I start the topic? Give me a thumbs up. Thanks a lot for your compliment. And definitely, whatever videos you are seeing one by one, they are all scheduled in line. And I'm going to take all these topics live on YouTube. So thank you so much for your compliment. Yes. So can I tell you what is thrombosis? Can we continue? So let me tell you what is thrombosis now. You understood what is hemostasis? Now let me tell you what is thrombosis. Listen, listen. I told you this is a blood vessel and this is also a blood vessel. See, I'm drawing two blood vessels in front of you to explain you the difference between hemostasis and thrombosis. So this is a blood vessel you can see and this is also a blood vessel you can see. Okay, let me draw the endothelial lining. You will understand. So this is the endothelial lining of the first blood vessel, but you can see it is disrupted. You can see the area of disruption. This is disruption. See the second blood vessel, see the second, and see the endothelial lining in that. You will see, ma'am, it's continuous. Everywhere it's continuous. It's not disrupted. It's not injured. So the first blood vessel is injured. The second is not injured. Got my point? The first is injured. You can see the disruption, and the second is not injured. Okay. Now the clot is forming. Here also first primary clot is forming with the help of platelet adhesion, activation, aggregation. ठीक है, and then it get converted into secondary clot with the help of fibrin thread. Okay, है ना? So this is known as hemostasis. This is known as hemostasis. It's physiological phenomenon and it's useful. It's useful. I want this to happen. But if the same thing is happening in the second blood vessel without injury, you can see here also the same steps are taking place. So first a primary clot is formed. Again the three steps: platelet adhesion, activation, and aggregation. This is primary clot, the platelet clot, and then it is converted into secondary clot with the help of the fibrin. Okay, so primary and so exactly same. But the only difference you can see in the above image and this image, this is known as thrombosis. This is known as thrombosis. The only difference, this was injured. This blood vessel is injured, and this one is uninjured. Exactly same it is formed, but it is uninjured. So this is not a physiological phenomenon. The thrombosis is a disease. It's not at all useful. It is harmful because it is obstructing the flow to some organ. So this is thrombosis. You know the step of the thrombus formation, the same step. How does the primary clot form? Platelet adhesion, activation, aggregation. And how does the secondary clot is formed? With the help of the fibrin. So everything is same except one thing. The one thing is injury. If the clot is formed in an injured blood vessel, let me see. If the clot is formed in an injured blood vessel, it is known as hemostasis. And if the clot is formed in uninjured blood vessel, it is known as thrombosis. Okay, uninjured blood vessel. So here the main point is it is uninjured. And you know the mechanism, everything is same. Got it? Everyone give me a thumbs up. Can we go ahead? So this is thrombosis. I hope you all got it. Now this thrombus, where it is formed? Let me tell you the type of thrombosis. It can form in the artery. Maybe this blood vessel is an artery. So it is arterial thrombus. Or else this blood vessel is a vein. So example, it can be a venous thrombus or it can be heart. It is in cardiovascular system. It can be heart. So in the heart, it is in the form of the vegetations. In the heart, it is in the form of the vegetations. So there are three types of thrombus: cardiac, arterial, venous. So what is a thrombus? Can you define? Say, ma'am, thrombus is a clot. It is a clot, the primary clot and secondary clot, but it is an uninjured blood vessel. Normally, clot is an injured blood vessel. That is known as hemostasis. But here, thrombus is also a clot, but the only thing it is uninjured. So I guess everyone got the definition. Now we'll tell you the pathophysiology, types, gross, microscopy, differences between arterial and venous, and fate. So these are the headings under which we are going to discuss. So you already got the definition. Okay, you can see here. There is no injury to the blood vessel. See the clot formation. See the clot. You can see the platelets and you can see the thread. The thread is the fibrin. So primary as well as secondary clot. You can see here. Got it? So hemostasis occurs after injury, but thrombosis occurs without injury. That is the only thing. Hemostasis is useful. It's physiological. Thrombosis is pathological. It's a disease. It's harmful. I hope everyone got it. So what is the pathophysiology? You may be thinking, ma'am, why it is occurring? So if there is no injury to this blood vessel, if the lining is continuous, still you are seeing the clot is formed. Why the clot is forming then, ma'am? Why the clot is forming? There are three causes. That is the pathophysiology. In an uninjured blood vessel, why the clot can form? There are three causes. So these three causes are known as Virchow triad because Virchow is the name of the scientist who discovered these three reasons. So these are the three causes which are discovered by Virchow. That's why the three causes, I will show you all three here. That is known as Virchow triad. So the first cause, you can see the endothelium is disrupted. Here I am in the blood vessel, there is a culprit. For example, in the blood vessel, there is a high level of cholesterol. There is some toxin which is causing endothelial injury. But you know, it is not through and through defect. The bleeding is not taking place. Only a little bit endothelium is injured. A little endothelium is disrupted. endothelium is disrupted, but I mean to say the subendothelial tissue is intact. The subendothelial tissue is still intact. Only endothelium is disrupted. So bleeding is not taking place now. So clot should not form. Clot should not form. But the platelet think that there is an injury and they are forming the clot here. The platelet will form the clot here. Platelet will come and form a clot here. So I will not call it hemostasis because it is not stopping the bleeding. Bleeding to hai nahi. There is no bleeding. So I will not call it hemostasis. I will call it thrombosis. So first reason is endothelial injury. The first reason is endothelial disruption or injury by some culprit. This is the first cause of thrombosis. The first one. Got it? The second one, blood is always flowing. In all of us, the 5 liter of blood is there and the heart is pumping constantly. So whenever the left ventricle contract, do the systole, the blood coming out in the aorta and distributed throughout the body. We know that. So blood is flowing. I mean the word flow. Insist the word flow. It's always flowing. It's always flowing. So there is a rule known as Bernoulli's theorem. Have you read Bernoulli's theorem in physics? I guess everyone. So what does the Bernoulli's theorem says? Bernoulli's theorem says that in a pipe, whenever the fluid is traveling, the principle is that the heavy thing travel at the center. Okay, and the light thing travel at the periphery. Let's consider the blood vessel as a pipe. In the blood vessel, we have 3 types of cell: RBC, WBC, platelet, and plasma. So who is the heaviest? The heaviest is WBC. So WBC is at the center. Okay, WBC is at the center. After that, at the periphery, RBC and platelet are there. RBCs are also there and platelets are also there. Let me draw the platelets are also there. But my point is that lightest is plasma. सबसे light है plasma. Plasma forms the periphery. At the periphery, there is always plasma. The blood cells are never come in contact. So you can see here the platelets. These are the platelets. They are not coming in contact with the endothelium. Platelets are not coming in contact with the endothelium, so they cannot form the thrombus in us. So thankfully, the Bernoulli theorem holding good in all of us. So because of which the platelets are not coming in contact, because the plasma is forming a rim. It is forming a border which is separating the platelet from the endothelium. So they are not coming in contact. So they are not depositing here and forming a clot. No, it's not happening. But imagine this is the flowing blood. Again, insist the word flow. Now imagine the blood is having stasis here. And there is stasis of the blood. Instead of flowing, the blood is stasis due to any reason. Whenever there is a stasis, the gravity, Newton, we know Newton discovered gravity and it always hold. Whether we are bothering or not bothering, aware or not aware, gravity is always working. So here, because of the gravity, the platelet will fall here. And because the platelet will fall, it will come in contact with the endothelium and form a clot here. So second reason is stasis. The first reason I told you is endothelial disruption. Second is stasis of the blood. In stasis of the blood, the thrombus is formed. Any area of the body in the blood vessel, the blood is stasis. It's not flowing. It's stasis. The thrombus will form. That is the second. And the third and the last reason, in Virchow triad, in a blood vessel, we have 2 types of substances: coagulatory proteins and anticoagulatory proteins. And we have a balance between the two. Coagulatory and anticoagulatory will clot and anticoagulatory will inhibit the clot. But whenever I have any injury, just suppose I got a cut over here. Listen, I got a cut. At that time, immediately, jaise hi cut hoga, the concentration of these will increases so much and the concentration of these decreases so much in the blood. It happens automatically. So the clot will form and they will seal the area. But without injury, sometimes without injury this happens. So this is known as hypercoagulable blood. So such a blood is known as hypercoagulable blood, in which without injury the concentration of coagulatory substances are more or anticoagulatory substances are less. So without injury they clot. So this is the third reason. So what are the 3 reasons of Virchow triad? Can you tell me what is Virchow triad? Virchow is a scientist who explained us why the thrombus is formed. Tell me the 3 causes. So first is endothelial disruption, but subendothelial tissue is intact. Bleeding is not there. The second is stasis of the blood. Okay, because of the gravity, that the platelet will fall and come in contact with the endothelium. Normally Bernoulli's theorem is working, but whenever there is a stasis, the Newton's law, that is gravity, will work. And the third is the hypercoagulable of the blood, hypercoagulability. Say yes if you all got it. Say yes. So these are the three things in the virtual triad. Now you know what is the definition of thrombus, and now you know the three causes of the thrombus. That is pathophysiology. Now coming on the types of the thrombus. As I told you, the thrombus can be in the artery, arterial thrombi, can be in the vein, venous thrombi. Sometimes it can be in the heart, which is known as vegetation. So in the heart, we are not studying here. We will see in systemic pathology and endocarditis, I will teach you this. But the arterial and venous one, I will continue here. So it can be in the artery, it can be in the vein. The best diagram I have drawn. I have drawn it for you, everyone on the screen. I want each and every one of you to concentrate here to see the differences between arterial thrombus and venous thrombus. So can you see this is an organ? Of course, you all can see. Can you see this is an artery giving blood to the organ? See the arrow. And this is a vein carrying the blood away from the organ. In the center, there is an organ. Which one is artery? See the arrow. The artery carry blood towards the organ and the vein carry the blood away from the organ. So this is the artery, this is a vein. Here also you can see a thrombus. Here also you can see a thrombus. In both of them, the thrombus can be formed. In the artery also arterial one, in the venous also venous one. Now see, tell me the differences between them. Tell me the first difference. The arterial one is white in color or yellow in color. You can see I have used yellow color here. It is white or yellow because it is having more platelet inside. The platelet are whitish or yellowish. So it is white in color or yellow in color because of the paleness. It is more platelet. The venous one is always red in color because it is having RBCs inside that. That is giving the red color. So first thing, the color is different. Please learn. The arterial one is pale or white and the venous one is red. Please take this picture in your mind. Take a snapshot, not in your mobile, in your brain. Anna, so take a snapshot. This is the arterial one. This is the venous one. Got it? Now arterial one, both of them are obstructing. Anna, arterial one, you can see it is partially obstructing. You can see this is the thrombus, but there is still a space is there from which the blood can pass. It is not through and through complete obstruction. It is known as mural. Mural means incomplete obstruction, partial obstruction, incomplete obstruction. But on the contrary, see the venous one. Venous one is through and through pack. The blood cannot pass even a little bit. No, it cannot pass because it is complete occlusion. It is known as occlusive. So mural means partial obstruction and occlusive means complete obstruction. So arterial one are mural and the venous one are occlusive. So this is the second difference. No need to learn. They are visible in the diagram. Anna, your pictorial memory is more strong than textual memory. If I show you the difference ka table, learn this table, you will say, ma'am, I will forget. But if I show you this diagram, you will never forget. So this is arterial, this is venous. This is pale, yellow, white. This is red. This is having more platelet. This is having more RBC. This one is partially obstructing, that is mural, and this one is complete obstructing, that is occlusive. The third difference. In the arterial one, can you see the alternate light, dark lines are there? Light, dark, light. These are known as lines of Zahan. So here lines of Zahans are present. You can see I have drawn it beautifully. But in the venous one, I can't see such lines. No light, dark bands. So here the lines of Zahan are absent. You may be thinking, ma'am, what are this alternate light, dark? Wherever there is a light, there is platelet and fibrin. And wherever there is a dark, it is RBC. So actually they are arranged in layers. So platelet, fibrin, then RBC. Platelet, fibrin, then RBC. Platelet, fibrin, then RBC. Like that. Here they are arranged in layers, but here there are no layers. So here lines of Zahan are present, here lines of Zahan are absent. That is the third difference you must understand. Got it? Now you yourself use your brain and tell me the effect. Tell me the effect of arterial one and the venous one. Use your brain. Use your common sense. See, if the artery is obstructed, what will happen to the organ? You say, ma'am, artery supply pure blood. So the organ is not receiving the pure blood. The oxygenated blood is not given to the organ or partially given, not completely given. So the organ will have ischemia because the oxygenated blood is not supplied because the artery is obstructed. The artery supply the pure blood, oxygenated blood. So the effect is ischemia. Okay. Now use your common sense and tell me what happens if the vein is obstructed. You see, ma'am, pure blood is coming. There is no obstruction in that. Organ is receiving the pure blood. So there is no ischemia. But the impure blood, deoxygenated blood cannot be carried out. It will remain inside the organ only because the vein is obstructed. So the impure blood will accumulate inside the organ and it will lead to edema. So no need to learn anything. Arterial one leads to ischemia and the venous one leads to edema. Say yes if you got it. Arterial one leads to ischemia. Venous one leads to edema. You have to learn that. Okay, understand that. Now, one more last difference, the fifth one. One more difference I want to tell you between arterial and venous. See, the arterial one. Where is the point of origin? Let me show you. So this is the point of origin. You can see from here, this point, it is arising. See the point of origin, है ना? After originating from the point, it is growing and propagating in opposite direction as that of blood flow. So blood is flowing in this direction, so it is propagating, growing in size in opposite direction. This is known as retrograde propagation. So arterial one grows in opposite direction to that of flow of blood. That is known as retrograde obstruction. Got it? What about the venous one? This is the point of origin. This is the point of origin. Venous one, after the point of origin, it will grow in the same direction as that of flow of blood. So this is known as antegrade propagation. What it is known as? Antegrade propagation. So in artery, we have retrograde propagation. In vein, we have antegrade propagation. How many of you got these differences? Give me a thumbs up if you got it. Give me a thumbs up. Got it? Huh? So tell me the differences. Tell me the differences between arterial one and venous one. Let me ask. Rather than learning them passively, let's actively recall them. Anna, this is the best way we can revise. Arterial thrombus, venous thrombus, the two type of thrombus. The first thing, you have to tell me their color and the reason why their color is different. Okay. Second thing, you have to tell me their occlusion. I mean their occlusion is partial or complete, and you have to tell me that term also. First, third thing, you have to tell me lines of Zahan. Lines of Zahan, in which it is present, in which it is absent. Lines of Zahan. Okay, the fourth thing, you have to tell me their effects on organ. And lastly, you have to tell me their propagation, direction of propagation. Can you start saying, people? Can you start saying quickly, please? Huh? So please, can you tell me? Vinay, Maitri, Abdul, MBBS Diary, Chandan, anyone from the audience, please. So tell me the color. Arterial one is, say ma'am, it's pale or white in color because it is having more platelet as compared to RBC. But venous one is red in color because it is having the RBC. Yes, got it. Tell me the occlusion. Say ma'am, here occlusion is always partial. Partial means mural. Instead of partial, say it's mural. And here obstruction is always complete. Instead of complete, say occlusive. This one is occlusive. Come on the lines of Zahan. Here lines of Zahan are present. Alternate light, dark, light, dark, light, dark. And here lines of Zahan are absent. Okay, tell me the effects. If the artery of any organ is obstructed, that organ will not receive the pure blood, oxygenated blood. So ischemia will happen to that organ. That organ will have ischemia. But if the vein of any organ is obstructed, impure blood cannot be drained out. So that organ will have edema. Okay, so that is the effect. Finally, the propagation, you have to comment on the propagation. What happens in the propagation? Here, the propagation from the point of origin, it will grow in reverse direction. That is known as retrograde propagation. And venous one grows in the same direction as that of blood flow. It is known as antegrade. Now you can imagine the diagram in each of the point and you can memorize it well. So this table is done. This table is done. This is the lines of Zahan. You can see. You can see this is alternate dark, light, dark, light. You can see the RBC, fibrin, RBC. You can see dark, light, dark, light, dark. So this is the arterial thrombus in which the lines of Zahan are present, right? And now you can understand all these differences very well. You don't have to need to learn this. You have to learn this diagram. How many of you got it? So we are done with the arterial thrombus. We are done with the venous thrombus. Arterial one are white, venous one are red. We are done. You can see this is a white thrombus in the artery. You can see this is a red thrombus in the vein. Give me a thumbs up, people. Got it? So that is the thrombus. What is the fate of the thrombus? No, the thrombus is there. Now, either with time it will resolve. It will decrease in size, it will resolve. It will disappear of its own, or it is fixed size. Whatever size it is formed, it will remain fixed. Hana, that is, it is organized. It become fixed, it become calcified, hard, and it become fixed. Hana, or with time it will increase in size. That is known as propagation. So with time, either it decrease in size, or fix in size, or increase in size. If it is decreasing in size, it's known as resolution. If it is fixed in size, it's known as organization. And if it is increasing in size, it's known as propagation. You have to learn the names. Or the fourth thing, it will disrupt. It will disrupt from the point of origin and freely start moving here and there. It is known as embolism. So with time, the four things can happen to a thrombus. Either it decrease in size, or it remains same size, or it increase in size, or it disrupt. So say the terms. If it decrease in size and disappear spontaneously, it is known as resolution. The best fate. It resolves. Resolution. If it is same, always same, it is known as organized. It is organized. The thrombus is organized. And if it is increasing in size with time, it is known as propagation. And if it got disrupted and moved freely here and there, it is known as embolism. How many of you got it? This is the fate. So basically, we are done with one topic of today. That is thrombosis. How many of you got it? Can I come on the second topic? Can I tell you what is embolism now? We are done with thrombosis. So can you tell me, can we revise it quickly? What is the definition of thrombosis? The definition is, it is the formation of clot in uninjured blood vessel. The point to be highlighted here is uninjured. The blood vessel here is uninjured. If it is formed, the clot is formed in injured blood vessel, it is known as hemostasis. But if it is forming in uninjured blood vessel, it is known as thrombus. What is the pathophysiology? Virchow triad. Virchow triad. Virchow has given 3 causes. What are the 3 causes? Number 1, endothelial injury is there. Okay. Number 2, stasis of the blood is there. And number 3, hypercoagulability of the blood. So I have explained you each of them. Okay. What are the types? In the types, I have taught you 2 types. The arterial one and venous one. And we have seen the grossly differences between them. The arterial one is white in color. The venous one is red in color. We have seen the differences in their microscopy. We know the difference ka table. Fate mein there are 4 fates. Either it will decrease, remain same, increase or disrupt. That is either it will resolve, organized, propagate, or it will form the embolus. So that is the thing. Coming on the next topic, embolism. Can I start embolism, people? Are you people there? Let's start embolism. What is embolism? What is embolism? So I will teach you embolism in these headings one by one, and we will revise it in the end quickly. Embolism is any mass in the lumen of the blood vessel. Can you see this is a mass? The mass can be solid, can be liquid, can be gas. So any mass, solid, liquid or gas, freely moving in the blood vessel and obstructing the flow of the blood is known as embolism. And this is known as embolus. The phenomenon is known as embolism. So this is embolism. Okay. Now sometime one of the embolus, most common, you see ma'am from where this mass is coming, 90% time it is a thrombus which got disrupted. See, this is a thrombus. Till the point it is attached, I will call it thrombus, thrombus, thrombus. The point it will detach and start freely moving, I will not call it thrombus no more. Now I will call it embolism. So most of the embolus are thromboembolus only, 90%, but there are other types also. So this is the embolism generalized definition. So it can be a mass in the lumen of the blood vessel. It can be solid, it can be liquid, it can be gas. It is freely flowing in the blood. Now coming on the classification of the embolus. There are 4 types of embolus. The first classification depending on the physical state. Is it solid, liquid or gas? The second, whether it is infected or not. The third, the source, is it an artery, vein or heart? And 4th, depending on the flow of the blood. Okay, I will tell you all 4 classification. The first classification depending on the physical state. It can be solid, it can be liquid, it can be gas. There are 3 types of embolus. The solid, the best example is thromboembolus. The thrombus is a solid thing that got detached and converted into thromboembolus. So such an embolus, thromboembolus, is a solid embolus because it is made up of thrombus. The thrombus is a solid clot. In the liquid one, the best example is amniotic fluid. I will explain in detail from where it is coming. Or one more example, fat embolism. So fat and amniotic fluid are liquids and they are forming a mass and moving freely in the blood. So that is liquid. And in the gaseous, there is air embolism. So there is air present in the lumen of the blood vessel freely moving. So that is air embolism. We will study all 3 in detail one by one. Okay. Okay. So this is the first classification. The second classification based whether it is infected or not. So if it is infected, it is known as septic. If it is not infected, it is known as bland. So 2 type of embolus. This embolus is freely moving. So I have to see whether it is infected or not infected. If it is infected, I will call it a septic embolus. If it is not infected, I will call it as a bland embolus. So it can be septic, it can be bland, depending on its surface whether bacteria are present or not present. So that is the second classification. The third classification, it can be in the artery, it can be in the vein. I told you, and the 4th one, depending on the flow of the blood. If it is flowing in the same direction as the blood is flowing, it is known as normal embolus flow in the same direction as that of blood flow. But sometimes the embolus rarely flow in opposite direction that of blood. So this is known as paradoxical embolus. So such an embolus is known as paradoxical embolus. This is an embolus which is flowing in opposite direction as that of blood flow. This is known as paradoxical embolus. So please learn that. And let me ask you a question. This is an organ. Okay. This is artery to that organ. You can see it is carrying blood towards the organ. And this is the vein to that organ. It is carrying blood away from that organ. Now let me ask you a question. If the embolus is present in artery, can it pass in the vein? Or else, if the embolus is present in the vein, can it pass in the artery? So my question is, can arterial embolus can be converted into venous, or venous can be converted into arterial? Directly answer is no. The embolus cannot pass through the capillary. There are capillaries in between. Embolus cannot pass through that. They are very, tiny capillaries. So what is the way? Can I convert an arterial embolus into venous or venous into arterial? Can they cross? Yes. So through foramen of oval. Can you see this is the heart? in the heart, you can see this is interarteriolar septum, and you can see there is a foramen of Oval. So from foramen of Oval, it can shift from here to there or there to there. So this is known as retrograde embolus. Retrograde embolus, I'm sorry, this one is known as paradoxical embolus, which is traveling either from arterial side to venous or venous side to artery. So here an embolus can travel from the venous side to artery or arterial side to venous, vice versa. This is paradoxical. And if an embolus, the blood is flowing in this direction, but the embolus is flowing in this direction, opposite direction, so it is known as retrograde embolus. So don't get confused. Even I got confused here between the two terms. So what is paradoxical embolus? This is paradoxical. It is traveling from artery to vein or vein to artery via foramen of Oval. This is known as paradoxical. And what is retrograde embolus? This one. So blood is flowing in one direction, but the embolus is flowing in opposite direction. This is known as retrograde. How many of you got it, people? So please, in the exam, you can have confusion between the two terms. Paradoxical embolus का मतलब क्या है and retrograde embolus का मतलब क्या है. So we are done with the classification. Okay. We are done with the classification. Okay. Now, who will tell me the effect of arterial embolus on the organ and effect of venous embolus on the organ? Let me draw the diagram and ask you. So this is the organ. As usual, you can see this is the artery supplying pure blood to the organ, and this is the vein carrying impure blood away from the organ. This is artery. This is vein. Let's talk about the artery. You tell me, if there is an embolus in the artery, what will happen to this organ? What will happen to this organ? Tell me the effect. Tell me the effect. Huh? Tell me the effect. If there is an embolus in the artery, obviously the pure blood supply will not be there, or it will be restricted. So this organ is getting less pure blood or no pure blood because of the obstruction cause. So this organ will have ischemia, infarction, necrosis, and gangrene. The thing is same, है ना? It will have first ischemia, है ना, followed by infarction, followed by the tissue will be dead. The area which do not get the blood undergo coagulative necrosis. So there will be coagulative necrosis, and necrosis में putrefaction will occur. It will convert into gangrene. So it can have ischemia, infarction, necrosis, and gangrene. The meaning is the same because it is not getting the oxygenated blood. That's why, because it is an artery supplying pure blood to the organ and it is obstructed by the embolus. You can see here is an embolus. It is obstructing the blood flow. So these are the consequences of the arterial thrombus. Very easy to understand. Very, very easy to understand. I guess everyone got it. But who will tell me the effect of a venous embolus? Let's see. Who will tell me? So let's remove the arterial one. Let's come on the next question. I guess arterial one, everyone can understand. There is no rocket science in that. But tell me the effect of a venous embolism on the organ. Who will tell me? Who will tell me? Write down in the chat box. I'm waiting. So if there is an embolus in the vein, not an artery, what will happen to this organ? You tell me. You can see there is an embolus. Embolus is freely moving. I'm waiting for your answer. Write down. Someone. Give a guess, yaar. Come on. At least give a guess. So what is the correct answer? If there is an embolus in the vein, what will happen now? What will happen? If there is an embolus in the vein, what will happen to this organ? Huh? Anyone from the audience? Vein carry impure blood away from the organ. Huh? Edema. I was expecting someone should write edema. No, edema will not happen. Listen, Kapala. Listen, why it will not happen? Why? I told you in thrombosis, edema was happening, but thrombosis was fixed here. It is fixed. Hana? Imagine if it is fixed here. It is thrombus. It is fixed here in the vein. So here the impure blood cannot leave and it will accumulate here. That's why it will lead to edema. But it is not a thrombus, dear. It's not a thrombus. It's embolism. Embolism freely move. It is not fixed. It is freely moving. So it cannot lead to edema. So the blood is not accumulating here. I mean to say the blood will pass. The impure blood can easily come out. It will pass. It will not accumulate. The impure blood will pass and it will carry the embolus with it. So where does all vein go? Now use your common sense and you tell me where does all veins go. So let me show you a diagram. Can you see this diagram? Can you see the organs in this diagram? This is the organ. Say any organ, any organ, any organ, any organ, any organ in your body. So all the organs are supplied by artery and drained by the vein. Now I'm talking about the embolus in the vein. Hana, vein of any organ. Hana, so it is not obstructing because it is freely flowing. Hana, it will not cause edema to this organ. All the vein will go in SVC, IVC. So the embolus will finally reach the SVC or IVC. Superior vena cava, inferior vena cava. All the vein, whatever vein you talk, ultimately all the vein lead to SVC, IVC. So embolus is freely moving. Along with the vein blood, it will flow to the SVC, IVC. So it will go to the SVC, IVC, SVC, IVC. All the SVC and IVC blood is drained in the right auricle. So embolus will reach the right auricle. Right auricle, it will reach the right ventricle. From the right ventricle, it will go to the pulmonary artery. Let me draw with different color. Okay, it is going in the pulmonary artery. and from the pulmonary artery it is reaching the lung, and in the lung it is going in the pulmonary capillary. I mean, they are obstructing the pulmonary capillary, so it will lead to pulmonary edema. It will lead to pulmonary edema, है ना? It will not lead to edema of that organ. No, it will lead to edema of the lung. You will say, ma'am, you mean if there is the embolus in the liver, embolus in the kidney, embolus in the brain, embolus in the heart, embolus in the spleen, embolus in the intestine, embolus in the stomach, any organ ka vein ka stomach leads to edema of lung, not edema of that organ. Yes, all organ vein embolus leads to pulmonary embolism. So that is deadly. है ना? The lungs. In the lungs, there is pulmonary edema, pulmonary embolism. And sometimes it's very severe. It's very severe. Person can't breathe. Person have sudden dyspnea and person dies. It can be as severe as that. Okay? It can be as severe as that. How many of you got it? How many of you got it if you say? Huh? समझ में आया? So my point is that if there is an obstruction in the artery, there is ischemia of that organ, but if there is an obstruction in the vein, I mean embolus in the vein, it will lead to pulmonary embolism. So tell me, what is the effect on organ? Effect on organ. Effect on organ. What is the effect of arterial embolus on organ? Embolus on organ. And what is the effect of venous embolus on organ? Arterial one is very easy to understand. Same as ischemia, infarction, necrosis, gangrene. We can understand because pure blood is not coming. But the venous one, all the veins will lead to pulmonary edema or pulmonary embolism, which is deadly, which can be very fatal at times. How many of you got it? So please learn the summary. Please learn what is the effect of arterial embolus and what is the effect of venous embolus on the organ. So we got it. Say yes if you got it. So that is the thing written in front of you. Arterial embolus leads to it will lead to ischemia infarction, and venous will lead to pulmonary thromboembolism. Let me show you. The arterial one leads to ischemia, gangrene, infarction, sometimes sudden death. For example, if the brain artery is having the embolism, the person can have stroke. है ना? Cerebral artery. If the coronary artery have an embolus, the person can have MI. So it can be various manifestations like that. But the venous one, all the veins, है ना, they drain in SVC, IVC. From the SVC, IVC, they will go in right auricle. From the right auricle, they will go in right ventricle. From the right ventricle, they will go in pulmonary artery. And finally, they will lead to pulmonary embolism. Got it? Okay. So that is the pulmonary embolism. Okay. So I will teach you 4 types of embolism now, one by one. The 4 important. This one is solid. These 2 are liquid. And this is gas. So first I will tell you thromboembolism, from where it come, then fat embolism, from where it come in the blood, gas embolism, and amniotic fluid embolism. Let's take them one by one, and each one of them can be in the artery, can be in the vein. I'm not interested in the arterial one, but the venous one is dangerous. So we will discuss the venous one of each of them, because venous one will lead to pulmonary embolism and death in each of them. So each of them can be arterial, each of them can be in venous. The composition is different. You are getting my point? So let's start with the first one, thromboembolism. From where it is coming? Tell me the source. Thrombo, naam mein hi hai. It is coming from the thrombus. It's an embolism which is derived from thrombus. So you can see the diagram. You can see this is the thrombus. It is attached with the blood vessel. Till it is attached with the blood vessel, it is known as thrombus. Once it gets detached, it is known as embolus. Once it gets detached, it is known as embolus. So what is the embolus? It is a detached thrombus. It is the most common. Among all, it is 90%. And the remaining all are 10%. Got my point? It is the most common embolus. So that's it. It can be arterial, it can be venous. Hana, the second one is the fat. Okay, we got thromboembolism coming from thrombus. But from where the fat embolism is coming? You can see it is a fat lobule. Hana, you can see a fat lobule is traveling in the blood. From where it is derived? Hana, from where the fat is accumulating, forming a lobule, and it is traveling from here to there. This is fat embolism. It's a fat globules. From where it is derived? You know, we all have bones. In the bones, we have red marrow and yellow marrow. The yellow marrow have the fat. Now imagine a person have fracture of the bone. A person have fracture of the bone. Fracture. So the yellow marrow leaks out in the blood. The yellow marrow leaks out in the blood, and it will form this fat embolism, the fat globules. Got it? Say yes if you got it. Huh? So this is how fat embolism is formed. So it is the traumatic cause. But sometimes without fracture also this can form. This is the most common cause is fracture. But without fracture also it can form non-traumatic causes. So it can case of extensive burns, diabetes, fatty liver, pancreatitis, sickle cell anemia, decompression sickness. Actually, all these are conditions in which the blood have abundant of fat or lipoproteins like VLDL, HDL, LDL. So they will accumulate and they will form a globule. So it can be traumatic, it can be non-traumatic. Okay. Now the fat embolism. Now what is this blood vessel? Say, ma'am, it can be artery, it can be vein, I don't know, it's not visible here, is it artery or vein? But it can be in the artery, the fat embolism can be in the artery. I'm not interested in that. It will lead to ischemia of that organ, we know, but I am interested in vein. I'm interested in vein. Now imagine you are a orthopedician. ठीक है ना? It's a dream branch of many students, maybe especially of boys. You are orthopedician, है ना? A boy who was driving the motorcycle, a teenage boy, a college boy, 25-year-old boy, he got accident, road traffic accident. He was traveling bullet, he was traveling the bike, he got an accident and he got femur fracture, the fracture in the femur, very common, hai na? Femur fracture, and he is coming to you. You are orthopedician now. You have examined the fracture and you have fixed it. You have fixed it, howsoever you have put a cast over that, whatever, and you have fixed it. You have put a cast over that, hai na? And the patient is admitted. The patient is in the ward of the hospital. At 2 a.m. in the night, you got a call from the hospital, from the nurse, that the patient you have fixed today a cast that is dead. Oh my God, suddenly. What happened? Everything was very cool. Everything was very good. And there was a boy, he was young, he was having a road traffic accident, a minute injury. He was having a fracture in the femur. You have fixed that. The patient was admitted in the ward and you asked the boy that tomorrow we will discharge. But before you discharge, in the night only, he passed away. He passed away. What is pathophysiology? Now the family of this person will kill you. They will kill you. They will sue you that he was a young boy. There was nothing complicated in that. Why the person is dead? There was no comorbidity. Nothing was there. Why? What may have happened? So at the time of the fracture, the yellow marrow may have leaked. The yellow marrow may have leaked into the blood, forming a fat globule, the fat embolism, and it may have leaked in the vein. From the vein, it may have passed to SVC, IVC. From there, it may have go to right auricle, to right ventricle, and to the lungs, causing pulmonary embolism leading to sudden death. So this may be the story. But how to prove that? How to prove that? You will demand for autopsy. You will say someone should perform the autopsy on this dead body, the postmortem, to look for the lungs. If the lungs contain the fat globule. Got my point? Then this may be the pathophysiology. Got my point? Say yes or no. So here the autopsy is performed. Now just suppose I am the doctor and who is performing the autopsy on this dead body, the postmortem. So my responsibility is to take the lungs out, to cut the lungs properly and make multiple slides of the lung, and in that look for the fat globules. If I get the fat globules inside the lung, so this is the proven cause, that the cause of the death is fat embolism. After fracture, sudden death. Very common. After fracture, sudden death. How many of you got it, people? Kitno ko samajh mein aaya? Same story is written. So in certain patients, there is fracture of the bone. After that, there is sudden death. Sudden death after the fracture. On autopsy, we get numerous emboli, the fatty emboli in the lung. Hana? So the reason is the same. Hana? Reason is the same. Now this organ is bone. There is a bone fracture. Bone fracture. When the bone is fractured, the fat embolism is coming in the blood, in the vein especially. So fat embolism travel, go in the heart, right side of the heart, right auricle, right ventricle, and it will reach the lung, causing pulmonary embolism leading to sudden death. So this is the cause, this is the pathophysiology. Hai na? Now, if I'm the doctor who is performing the autopsy on this dead body, I will take the lung out, I will cut, make a slide. Now, in the slide, I'm not very sure whether this is fat or not fat. So for the fat, special stains are available. Two special stains are available for the fat. One is Sudan black, which will give the black color to the fat. And one is oil redo. It will give red color to the fat. So I will make a slide. You can see these are the alveoli. I will make the slide and stain it with this and this. So if the fat globule is there, it will get highlighted. Here with black color, here with red color. So the story is over. How many of you got it? How many of you got it? Can we go ahead? The third one. So till now we have studied two types of embolus. I taught you thromboembolus also. I taught you fat embolus also. The third one is amniotic fluid embolism. Amniotic fluid. Hana, you know in pregnancy, this is the pregnant lady. Can you see a pregnant lady? This is the uterus inside the lady, inside which the fetus is there. You know, fetus is surrounded by the amniotic fluid. Amniotic fluid is present around the fetus in the gestational period. Got it? Now, at the time of the labor, uterus is contracting vigorously. Uterus is contracting very vigorously. So at the time of the labor, when the uterus is contracting vigorously, the uterine vein, sometimes the uterine vein get disrupted. And the amniotic fluid travel from here into the uterine vein. Hana? So at the time of labor, Hana, this lady is in labor pain. At the time of the labor or immediately postpartum, uterine vein get disrupted because of vigorous contraction and the amniotic fluid can enter in the vein. The story is the same. It's a vein, na? Uterine vein is a vein. So it's going in the vein. It's going in the vein, uterine. This organ is uterus. This time this organ is not bone. This organ is uterus. Organ is uterus inside which the fetus is present. So organ, this uterus is contracting. The amniotic fluid is coming in the vein. So this is forming the amniotic fluid embolism. Again, the same story. All the veins, where does it drain? It will go. It will drain in the right auricle, from the right auricle to right ventricle, from the right ventricle to, again, pulmonary embolism and sudden death. So imagine you are an obstetrician now. You're not orthopedician now. Now the girls, and especially it is a branch of the girls. That's why. So you are an OBG, okay, obstetrician. And you are doing the delivery of a lady who is full term. So the lady is in labor. During the labor only, sudden death of the lady, or immediately after the postpartum period, sudden death. She is having dizzy and sudden death. So this can be the reason, amniotic fluid embolism. So it is the most serious, unpredictable, unpreventable cause of maternal mortality, and it will lead to pulmonary embolism. It can lead to sudden death. Say yes if you all got it. Say yes if you all got it. Can we go ahead? So whatever lectures you want, different people are asking me different lectures. Where is this link? So Nikhat, and all other people, kindly text me. At the end of the lecture, I will give you a contact number. It is only for chat support, not for calling. Don't call on that number. You can text your query, whatever link of any lecture on the YouTube you want, I will share it with you. Okay. So for some notes you want, some lecture links you want, or whatever study related help you want from my side, kindly text on that contact number. I will share in the end. Okay. Let's come here. So this is the thing. Now again, what we will do, this is a pregnant lady, and at the time of the labor, suddenly she is dead. Suddenly she is having dizzy and dead. So we have a suspicion the cause of the death is amniotic fluid. Again, we will order autopsy. So at the postmortem or autopsy, I am the doctor or the person who is performing autopsy on this dead body. So I'm performing the postmortem. So my responsibility is to take the lungs out, to cut the lungs properly, to make a slide. And now this time I want inside the lungs, there should be amniotic fluid. So this is a slide. Inside the slide of the lung, this is lung ka slide of that dead lady, the pregnant lady who is dead now. This is a slide of the lung, and inside which I can find the fetal squamous cells. Fetal squamous cells are coming from the amniotic fluid. So this is amniotic fluid composition I can see here. Say yes if you all got it. So the last embolism is gas. Till now we have studied 3 embolism in detail. I taught you thromboembolism, from where it is coming, fat embolism, from where it is coming, the fracture, and amniotic fluid embolism, from where it is coming. The venous parts of all of these is, you have to understand it with detail. And the last one I am teaching you the gas embolism. So embolism will be over. So here the gas embolism. Here the gas is there inside the blood vessel. There is a gas. You can see the gas is there inside the blood vessel. Now there are 2 forms you have to understand: air embolism and decompression sickness. I will teach you both. So let's come on the air embolism. You can see air in the blood vessel. It can be artery, it can be vein. Again, it can be artery, it can be vein, but it's air. Air inside the blood vessel. See, ma'am, from where it is coming? What is the origin? You give injections to the patient. Intravenous injection. We give IV injections in the vein, not in muscle, in the vein. We usually give it in cubital vein or any vein. Intravenous injection. So you give intravenous injection. Before giving the injection, you may have seen we take the air out. So we fill it with the whatever drug you want. So the drug is filled, but if there is a air, so we take the air bubbles out, and at the tip of the needle, whenever there is a drop of the medicine, then only we inject it. So sometimes if we are not taking the air out, we are directly injecting the air also. So ideally we should take the air out. If you're not taking it, you are injecting the air. So that can be the source, that is IV injections. During angiography, it can enter, or during operations, surgeries. During surgeries, head neck surgeries, we have major veins here. We have jugular vein. Over here, the head and neck surgery. Suppose I'm a head neck surgeon and I'm performing a surgery on a patient. So I'm doing the surgery here. By mistake, I got a cut over the jugular vein. So the environmental air can enter in the jugular vein. Got it? This can be the reason. Or just suppose I'm an obstetrician. I'm doing the normal delivery in a lady who is pregnant. So here also the major veins are present that can get disrupted during the delivery, and the environmental air can enter. So during operations it can enter. Got it? Again, the arterial one is not dangerous. The venous one is dangerous. The venous one is the dangerous. Now imagine the same thing. You are a surgeon, head neck surgeon. You are performing a surgery. The patient got cut in the jugular vein, and after the surgery or during the surgery only, patient have dizzy and dead. Got it? Or during the obstetric thing, or during angioplasty, this can be happen. So again, here I am talking about the air embolism in the vein, in any vein. Air embolism. So this air is going in the vein from SVC, IVC, right auricle, right ventricle, pulmonary artery, and finally in the lungs, and the person is dead. है ना. So I'm talking about venous air embolism. ठीक है. So I taught you venous fat embolism, in which so this person is dead. Again, I will perform the autopsy. है ना. So in the fat embolism, in autopsy, in the lungs, I search for fat. In the amniotic fluid embolism, death, in the autopsy, I search for amniotic fluid in the lung. So in fat embolism, I search for fat in the lung. In amniotic fluid embolism, I search for amniotic fluid in the lung. I make a slide of the lung and see it under microscope and see whether the amniotic fluid present or not, whether the fat present or not. What shall I see here? You will say, ma'am, you do the autopsy, I got it. You will take the lungs out. You will cut the lungs, make a slide and see it, examine it under microscope. Lekin air is invisible. I mean, fat is visible, amniotic fluid is visible, thrombus is visible, but air is invisible. You cannot stay in the air. You cannot hold the air. Air is like, psst, it will go away. Imagine if there is an ambulance over here. Imagine if there is an ambulance over here and I'm the doctor who is performing autopsy. So if I give a cut over here, the air will go away. It will evaporate. It will go away. It will go away. So I cannot hold the air on a slide. You are getting my point? So what is the solution of this? The solution of this, take a vessel, take a drum, fill water in that. है ना, and open the heart and the lung in situ model inside that. Now if you give a cut, for example, here is the ambulance. Now if you give a cut, the air will show the bubbles over here. The bubbles, you can see the bubbles in the water. If you can see the bubbles in the water, so it will be proven it's the air embolism. You cannot stain it, you cannot see in the slide. So here the heart and the pulmonary artery are opened in situ underwater. How many of you got it? So this is the precaution we have to take during autopsy or post-mortem whenever we are suspecting the cause of the death is air embolism. Whenever we are suspecting the cause of the death is thromboembolism, we have to directly cut the lungs and look for thrombus. Whenever we are suspecting fat embolism, we have to cut the lungs and we have to look for fat. Whenever we are suspecting amniotic fluid embolism, we have to cut the lung and look for amniotic fluid. But whenever we are suspecting air embolism, we have to cut the lungs underwater. I mean the complete specimen underwater. We don't have to give the cut to the lung. We have to give the cut to the pulmonary artery because lung mein to air hota hai. Lung already have the air. But in the pulmonary artery, if you get a gas bubble, it will be proven. How many of you got it? So that is a thing. Now coming on the decompression sickness, which is one of the thing of the gas embolism. So what is decompression sickness? Decompression sickness. It is usually seen in the persons who are divers. Can you see this is a diver? You know Henry law in chemistry. Have you read about the Henry law? What the Henry law says in chemistry. So the gases solubility is directly proportional to pressure. More pressure, more gas soluble. Less pressure, less gas soluble. It's a law, the Henry law in chemistry. है ना? Now this is the surface. है ना? And this is the water. So as you go deeper, you may be knowing the pressure increase. This is atmospheric pressure we have. And jitna deep, the more deep you go, the more pressure rise will be there. So pressure is normal pressure at surface. That is known as atmospheric pressure. And as we go deeper, the pressure will increase. Now this is a diver. Can you see this is a diver? The diver carries the gas with that. The oxygen, the cylinder, the gas. Of course, whenever someone is going deep in the water, they have to carry the gas with them. You can see this is the gas cylinder. And the diver is carrying the gas. So when the diver is going deeper, the diver is diving, the pressure increase. So solubility of the gas increase according to Henry's law. So all this gas you can see it is going inside this person and dissolve in the blood. It will dissolve in the blood. It will dissolve completely. Now there is no problem in that, but the person is doing rapid ascent. After this, the person is ascending rapidly. Whenever the person is ascending rapidly, you tell me the pressure is falling. Now in deep the pressure was increasing, and now when the pressure is falling, when the pressure is person is ascending rapidly, the pressure will fall. Solubility will also fall. So the gas which was dissolved till now, they will come out of the blood vessel in the blood in the gas form. So this will lead to gas embolism. How many of you got it? So you can see this is a blood vessel. Initially the gas was dissolved. It was because pressure was high. But later on when the pressure is low, the gas will become non-soluble and it will form the bubbles. So this is the thing. This is decompression sickness. And it can lead to bands, shock, cerebral effects like that. We are done with embolus. You know the definition. You know the 4 type of classification. You know the effect of arterial is ischemia infarction. But the effect of venous one is pulmonary embolism. Now I taught you 4 type of embolus: thrombus, fat, gas or amniotic fluid. Each of them can be arterial and each of them can be in the vein. In the vein, there is sudden death and we have performed autopsy in all of them. How many of you got it? I tried my best to explain you. Now, if you're a second prof student, this is a list of long questions, short questions for your university exam. And if you are targeting for any of the competitive exam, you will be able to crack any MCQ based on this topic. Now, whatever topic you are asking me to take, I will share a number, kindly text it. So my team will make a list and will schedule the YouTube lectures in that sequence. The topic which is in more demand, we take it first. But all the topics we are going to take ahead in future, don't worry. If you want the notes of this lecture, after this lecture, not currently, after this lecture, in the same chat box where you are watching right now, in the chat box, after this lecture, when it will be over, you will find the link. We will find the link of the notes. The link will be pinned. Okay, you have to just click on that and the notes. Not only this lecture notes, all the notes of the sessions which are taken on YouTube, they are available in that link, the same link, है ना? So after the session, come back, click on that link which is pinned there for the notes, and you will get the notes of all the topics which are taken on the YouTube by me. If you want the notes, the PDF form. Okay, now here is a QR code. I want you to scan it if you wish. I mean, you can take a snapshot or you can scan it right now. So please scan it if you wish. If you scan it, you will be connected with me on various social media platforms, on Instagram, Telegram, WhatsApp, where I share daily small reels or education related material, your study related material for your competitive exams of various subjects. So it will be highly beneficial for you. So I request you to scan it and connect with me on various social media platforms. And this is the contact number I was asking you to share or to save it. It's 9321001485. And whatever study related query or doubts you have, or any topic in your mind you want me to take it live on YouTube, you can text it here. Thank you so much. Thank you so much. Now let me tell you the schedule ahead. Every Tuesday and Friday we will come live 9:30 a.m. in the morning this month. So this is the schedule of this month, this week. So today the session is done on thrombus and embolism. The next session is on 9th of January. The next session is on 9th of January. It is a topic of PSM, community medicine. I will tell you the measurements of mortality, the 6 measurements of mortality: crude death rate, specialized death rate, proportional mortality rate, survival rate, case fatality rate, standardized mortality rate. We will discuss all the measures of mortality. It's an ultra important topic. Don't dare to miss that. After that, on the 12th, we are having one more session, case control studies in the PSM. And after that, we have a pharmacology topic on 16th, that is pharmacokinetics. The schedule after that, I will share you later on. Thank you so much. And always remember, consistency is the key. So be consistent. Don't be fast, but be consistent. Be consistent. Thank you so much. Bye-bye. Wishing you all the best. Definitely, I will schedule all these topics. But Kapala, I request you to text the topic on this number only. Because, you know, whatever topics we are getting in demand, we all accumulate here, the team accumulate, and they schedule the sessions in that sequence. So I request you to please, whatever topic is in your mind and you find it difficult, please text. I request you, text on this number, save this number and text on this number. Thank you so much. Thank you for your patience and giving your precious time to me. But I promise you, whatever time you have given to me for here on the YouTube, it's worth spending or watching. Okay, because it is highly, you know, whatever topics I'm taking here now, they are very, very important for your exams. So it will be worth. Thank you so much. It is not wastage, it's a worth. So thank you so much. Bye bye. Wishing you all the best. I'm just ending the session. Bye bye. God bless.